Are you there? So here's what happens on YouTube, and maybe it is the overlords, but what happens on the YouTube is if there's an internet glitch, it actually stops everything. I didn't know that, but now I was hearing everybody talking, so they couldn't see me, all right, over there on YouTube. So I apologize. Hopefully the YouTubers will jump back on. Yeah, Lion, sorry. I did recheck, and hopefully they're, back on and people can go over there and listen. Lion, if you don't mind, could you go over to YouTube and see if you can hear and see me over there? I just signed off and then signed back on. So we were talking about PPIs. I was answering the question about the vitamin D and the red blood cell and the hemoglobin A1C. I'm not quite sure if, what the true mechanism. I would actually have to look it up, and how a vitamin D deficiency could affect the hemoglobin A1C. In my walking it through in my head, I would say it would probably falsely lower the A1C. So let's see. Angel, YouTube got notification. Okay. So Angel's back on YouTube. Again, what is happening is that when YouTube has a glitch and the internet goes down, the live streams will actually just stop. So you can see me, you can't hear any audio. And I've figured this out over, maybe it's happened 3 times. And so now I know I got to just stop it. If somebody tells me, with a chat, tells me to stop, then I can just end it and sign back on. So thank you, Lion, for letting me know. I appreciate that. Thank you. I appreciate Lion going over there and looking. Okay, Penny's back. So she's here. She's back with us. Okay. And I do apologize for it going off, but now there'll be 2 Saturdays on YouTube. But maybe I just will only publish the first one and let the second one go. It just gets to be a mess. So we'll continue picking up where the questions left off. Do you guys have any questions for me? Talked about GLPs, GIPs, both for diabetes and for weight loss. We talked a little bit about the up-and-coming retaglutide, I believe it is, retaglutide. It's a triple G. The triple G is made by Lilly, which is... Let me make sure. Yeah, I don't know if I have it written down anywhere, the name of it. Again, there's a lot. I think it's maybe retaglutide or retatrutide, something. It's a triple G. So it's a GLP, a GIP, and the new glucagon agonist. So Arnell says, will Michigan be in March Madness? Well, for sure they're going to be in it. Will they be at the end? We can only pray for that. Good morning, Justin. Thanks for being here. Okay. So we talked about GLPs, GIPs, and the triple G, which is not on the market yet. It'll probably be late 2026, maybe early 2027. But again, the more G's you add, you are causing a blowing up of the engine. That's your body. That's your metabolic. That's everything that you're made of, just by trying to lose weight. There might be other ways. It might be something that you need to talk to your doctor about. Okay. Lion says, I'm hearing a lot about peptides for healing and muscle growth. Do you have any opinion on them? Well, GLP is a peptide. GIP is a peptide. These are peptides that are in our body. Peptides are chains of amino acids that make up a protein. So we have strings of amino acids. And it's just like anything else, Lion. You are inserting certain things into your system, hoping that it will assimilate. And maybe it will, maybe it won't. I don't know. I'm not well versed on peptides. I think that if I ate a good diet. I slept good. I got outside. I stood barefoot on the ground. I got sun. I exercised on a daily basis by lifting weights and doing walking in nature, hung around positive people, prayed that I personally would not need to take a peptide that interfered with my normal biologic and physiologic system, just like taking a GLP. That is a peptide. I don't want to change my own biology or my own physiology. I want to figure out, by peeling back the onion layers, why I have a problem instead of taking a medication somebody told me I had a deficiency of. I don't have a deficiency of it. I have something else. I don't have a deficiency of the peptide. I have deficiency of maybe malnutrition or exercise or whatever it might be. Okay? So I'm going to work at unpeeling the layers of the onion before I go and take a man-made synthetic something or other and put it in my body. But that's me, okay? And, you can fight me, but this and but that. And you know what? Defend it. Just take it. You don't have to defend it to me. You don't have to prove anything to me. Just take your peptide, whatever that might be. Yeah, Penny, I did answer your question on the Trulicity. Trulicity is a GLP-1 agonist, okay? It is. It was one of the earlier ones. It came out shortly after or around the time of Victoza and Ozempic, okay? Trulicity. Now, Trulicity is made by Lilly, so they've all started GLPs. So Lilly started out with Trulicity and then went to Mounjaro and then developed a Zepbound, whereas Novo started way earlier with Victoza and Saxenda and Ozempic and Wegovy, okay? There's basically just two companies with all of the market shares. And they just keep going back and forth and they develop and they do the thing. And in the meantime, there's more and more obese people and more customers for them. And nobody is wondering or asking the question, why? And then we'll blame somebody else for not setting enough laws. Well, why should they, why should, God, I don't want to get into the political jargon because that's not what it's about, but it does deal with our health. This is all about our health. If the food pyramid for the last 50 years told us to eat grains and processed foods, and we got more obesity, more high blood pressure, more diabetes, more heart disease, and somebody goes and flips the pyramid, do you defend the original pyramid and all the things and say, please give me my Ozempic? Or do you go through some painful time and say, I'm going to do this on my own? I'm going to stop eating processed foods, seed oils, and sugar instead of taking a peptide, for instance. But I can't tell you guys what to do. All I can do is teach you about the things and warn you about being bamboozled with the buffoonery. I can tell you about the history of the GLP and the history of the GIP and the history of the triple G. I can tell you all the side effects. I can tell you about their uses. But you are the ultimate decision maker. I just want you to have enough information to make a good decision for you. I'm not going to make a decision for you. And why people would fight me, you're just one of those grifters. You just don't want anybody to do anything. You think it's all our fault. I didn't say that. Never did say that. I just provided the information and you took it as an offense to your inner workings. You were offended by me giving you information. 75% of the people after 2 years stop taking the medication. Well, did I offend you? Well, why did they stop it? Well, maybe the cost. Maybe insurance stopped paying for it. Maybe you got side effects. Maybe you got some stroke in your eye. Maybe you got a bone fracture and you got osteoporosis. Maybe you lost 40% of your muscle mass. No, that wasn't the drug. It's done everything for me. I stopped gambling, I stopped smoking, and I lost 100 pounds. Okay, awesome. Awesome. And if you happen to get a stroke in your eye, it probably was not from the GLP, GIP, triple G. Probably not. If you got cancer, it probably was not from that. Okay? Diego says, we are responsible for our own health, not the government, not big pharma. We must educate ourselves and use common sense. I will no longer be a victim. So that's Diego. Diego is not me. This is Diego saying he's just a normal one of you guys. He's just a listener, or she, just a listener. Saying that, hey, you guys, wake up. We got to be our own doctor. Can we trust our doctors to give us all of the information? I don't know. But it sounds like you guys haven't been told these things. If I get a client that signs up with me to do a consultation, and they'll say, I'll say, you're on a PPI. Did you know that there's an increased risk of gastric polyps and gastric cancer, osteoporosis, dementia, malnutrition because you lack vitamins? Are you taking B vitamins? No, I didn't. Am I supposed to take B vitamins? What about your calcium and your magnesium and your zinc and selenium and iron? Did they tell you to do all those things? That's all I'm trying to teach you guys. Okay? So, all right. So we won't have any more of that, you guys, over there on YouTube. Some of these things are so distracting. Okay. All right. Yeah, SP Productions, I don't know anything about that peptide. So I'm not well versed at peptides at all. Okay. And so, Penny, did I answer your question on the Trulicity? It's a GLP that was came to market for the treatment of diabetes. Okay. Any other questions? Any health? I know I probably missed a lot on YouTube, but I can't see them. So, if you have a question, just put a Q in front of it. Let's see. No. Okay. All right, you guys. We can cut this short. If some of the things that I do, just to let you know, I do one-on-one consultations. I do these live streams every Saturday at 9 a.m. Central, every Sunday at 10 a.m. Central. I do consultations one-on-one. I review your medicines, your diagnoses, your lifestyle. I do not take the place of your doctor. I'm like your doctor coach. I'm going to help you understand what is going on, and then you can go back to your doctor, your provider, and talk through it. I also will order your labs for you if your doctor will not. If you want a fasting insulin level and your doctor says, no, I'm not going to order that, you don't need it, and you can't order it yourself, I can order it for you. That's just another thing I can do. It costs me really anything except for 5 minutes of my time. I would need your email address, and then I send you a cart of labs of your choice, and you can get them done. You do not have to pay me for a consultation. If you don't want me to read your labs and you want to do it all yourself, great. I do get a little bit of a discount, but a lot of people use ownyourlabs.com or lifeextensionlabs.com. If you want me to send you the exact same labs and do a price comparison, I can do that too. Again, it doesn't cost me anything, and it only helps you. I want you to save money, okay? Penny says, my taking it, diabetes. I'm concerned he's not ready. So Penny, I'm guessing you're talking about your husband. Your husband is taking Trulicity. It's a GLP for diabetes. I'm concerned, as you should be. He's not ready for the diet talk. I tried. Well, Penny, then, that's all you can do. He walked himself into the diabetes, and he's the only one who can walk himself out. He is a grown man, and he's able to make his own decisions. Unfortunately, it affects spouses, and that's obviously what you're dealing with right now. And I'm sorry to hear this. I can hear the frustration, but you can only be responsible for you. You are not responsible for other people's feelings or other people's decisions, okay? All right. Kashua says, have you thought about having a series of posts or reels about your weight training routine? No, I haven't thought about that. If you guys would like something like that, let me know. I love exercise. Exercise is my identity. It's just that sometimes I don't feel that people are interested in what Dr. Jensen is working out with. They're more interested, and again, I'm assuming, I'm speculating, I don't know. I speculate that people want information. They want to be told the behind the scenes. And I seem to be really good at telling you the behind the scenes things that no one else is telling you. And I want you to know these behind the scenes things so you can make better decisions and not be bamboozled in the future. By the way, there's a new apparel line. It's on my fourth wall. So YouTubers, and it's in the description. If you want to buy a t-shirt that says no longer bamboozled by the buffoonery, or a definition of ignorosis, those are all there, okay? There's all kinds of little garments and all that you can choose from. But it would be funny if some of you wore your no longer bamboozled by the buffoonery or the definition of ignorosis. That would be kind of cute, walking into your doctor's office. I wonder how they would take that. So yeah, let me know if you want some reels on exercising. I don't normally go that way. Metabolism IQ says, can you remind us the best tips before getting labs done as far as fasting, exercise, hydration? Good point. Much of the labs that you get that are baseline labs, let's just say, for instance, your blood sugar or your cholesterol levels, you should be fasting for about 12 hours, okay? If you go over 12 hours, the results aren't as accurate. You should get your labs checked between the hours of about 10 and 11 a.m. Why? Because cortisol starts to be secreted around 3 a.m. And so cortisol starts at around 3 a.m. and it's continuously secreted till about 9 a.m. And then at 9 a.m. it starts to level off until about 6 p.m. And then at 6 p.m. it starts going back down again. This is a normal rhythm in our body. If you get your cortisol level, or you get your labs checked at 7 a.m., your cortisol level is still quite high, or it's peaking, it's spiking, your blood sugar could be falsely elevated, okay? It likely won't change your hemoglobin A1C, but it can change other things. It could even change triglyceride level. So around 10 or 11 a.m. fasting, only 12 hours. Yeah, but Dr. Jensen, I usually go 16 hours, but then you're gonna have to wake up in the middle of the night and eat something so you don't go over 12 hours if you want good results. Also, do not exercise at least 3 days before your labs, and that includes sex. That is a form of exercise. So please don't do that either if you want an accurate. And then, of course, consistency. You want to be consistent. If you got this lab tomorrow at 10 a.m., make sure that you get your labs checked at 10 a.m. in 4 months or the next lab draw. I don't think I'm forgetting anything. Metabolism IQ. Yeah, if you don't fast, your triglycerides will go through the roof, because triglycerides are just telling me that you ate carbs within the last 72 hours, and a lot of them. So that's if they're going through the roof. I would just recheck them. Could you look at some other things? If, again, I would look at your blood sugar. Again, I would look at your A1C. I would look at your HDL. With high trigs, the HDL will usually be really, really low. And yeah, just try to be consistent with your obtaining your labs at the same time. Those are good questions. Thank you. Oh, geez. Where did my Instagram go? Where is my Instagram? Oh, there you guys are. Whew. All right. So hydration, just don't drink coffee. Drink water. It improves your vasculature. What's really hard is when the nurse is trying to get your blood and your veins are small and shrunk and rolling. And that just tells us that you haven't drank enough water. Yes, health is wealth, Angel, I agree. Yeah, metabolism IQ, did I answer all the questions as far as timing, what you should or should not do prior to getting your labs drawn? When you're getting insulin rides along with that cortisol. Insulin is like a roller coaster through the day, and insulin is not completely accurate, okay? It is a great value. But even if cortisol is elevated, right? Blood sugar is elevated, insulin is going to go up. So they usually ride together, okay? Not everybody checks a cortisol level, nor do you have to, okay? I'm just saying, if you get it at 7 a.m. in the morning, your labs, there's a high likelihood that your cortisol level is going to be up. Your blood sugar will be up. Insulin is going to be up. And then if you say, well, I'm going to come back at 2 p.m. Well, what if at 2 p.m. you were on the interstate, somebody crashed in front of you, you had a sympathetic fight or flight response, blood sugar went up, cortisol went up, insulin comes up, and then you walk into the doctor's office and you're like, oh my gosh, well, you wouldn't believe what just happened. Your labs are going to be thrown off, okay? Your labs, no matter what time, are going to be thrown off. So you got to try to be calm, all right? At least an hour before that you're coming in. Cheese says, how about your news listeners from Europe? I have a lot of listeners that are not from the United States, and I appreciate everybody. Thank you so much. Okay. No, this is for everybody, not just for the US. So thanks for being here. I have my hoodie on, so I can't really show you my biceps. But when I start wearing t-shirts more, then I'll show you my biceps. Let's see. 1910, I might have to start making you a moderator here. Sass asks, what are all of the different kinds of tests to do for diabetes? Well, you need to get a hemoglobin A1C. You should get a fasting blood sugar, and you should get a fasting insulin level. Now, there are other things that you could get. I guess it depends on what type of diabetes. If there is even a slight chance that you might be a type 1 or a type 1.5, you really need to get antibodies, diabetes antibodies, type 1 diabetes antibodies. There's 5 of them, and you should get all of them, okay? Some people say, oh, no, you only need 3. I would get all 5 and be, overly I would just be overly aggressive in checking. Okay. But if it's type 2, I would get a hemoglobin A1C for sure. I would get a blood sugar. I would check my triglycerides and HDL, and I would definitely get an insulin level. Okay. Kashua says, what if you are a shift worker? Mid-shift, overnight shift, that is going to throw things. I would treat your sleeping pattern the same. I think if you are a shift worker, I would treat your getting up at, 3 p.m. in the afternoon the same as 7 a.m. in the morning. And I would want you to probably be awake for a short period of time. But here's the thing. Part of our circadian rhythm is based on the sun. So we got to, in terms of a shift worker, here's what I'm going to sit with this. Just be consistent every single time. As long as you're consistent every single time, the results are going to be accurate for you. So if every single time you go in at 3 p.m. to get your labs checked, just make sure it's 3 p.m. every single time, okay? And make sure there's 12 hours of fasting, not 13, not 10, 12, okay? Okay, yeah, you're welcome, Sass. Thanks for asking. Anything else? You guys had some late questions coming in. So I was just telling you, if you want to sign up for a consultation or want your labs checked or me to order your labs, just email me at ironladydoc, IRONLADY, ironladydoc, DOC, at AOL.com. Ironladydoc at AOL.com. You can sign up for consultations. You can ask me to send you a list of labs that your doctor should maybe order. Or if your doctor won't order them, you say, Doc, can you order my labs and send it to me in my email? I say, yeah, watch for a lab coming from blah, blah, blah. And then you pay for it. You pick your own lab draw station. You do all that, and you can read your own labs. You'll get a copy of your labs. I will get a copy of your lab, but you don't have to hire me to go over your labs. If you choose to, great, I'm here for you. But if you want to do all of that on your own, do it on your own, okay? Metabolism IQ asks, have you seen the islet cell stem cell transplant to reverse type 1? Not yet. We have tried to transplant beta cells for a type 1 or even a type 2 with beta cell burnout. Your beta cells make insulin. And your alpha cells secrete, well, they don't secrete. They tell the liver to secrete glucagon. So the alpha cells are involved with glucagon, and the beta cells are involved with insulin. They are in the islets of Langerhans inside the pancreas. It's an area inside the pancreas called the islets of Langerhans that have the alpha cells and the beta cells. And for a type 1 diabetic who has antibodies, that's why we check antibodies for a type 1 diabetic. If they have antibodies, it kills the alpha cells in our pancreas. But it doesn't hurt the beta cells. Okay, repeat, reverse. If you are a type 1, you have antibodies to your beta cells that make insulin. But your alpha cells are still working. They release glucagon. So a type 1 or a type 2 who's got beta cell burnout and they are insulin dependent, remember that their blood sugars are going to be harder to control. Why? Because they're always chasing glucagon. They're chasing glucagon because the alpha cells are still pumping out or allowing for glucagon to be released into the bloodstream, telling to increase blood sugar. And then you are injecting, because you're a type 1 or a type 2 that's insulin dependent, insulin. But the insulin that goes into your stomach has to go through all of the body to circle back and tell the glucagon, the alpha cells, to cool it. okay? Stop making sugar go up when I'm trying to make sugar go down. Now, in a normal non-diabetic person, the alpha and the beta cells are like close neighbors, okay? And they talk to each other all the time. They're always talking to each other. I'm going up, you better go down. I'm going up, you better go down. Okay, they're not both up at the same time. Now, if here's the alpha cell and here's the beta cell, and the beta cells are gone, here's the alpha cell sitting, and he or she is not being talked to by the beta cell. The thing talking to him is your injection of the insulin. And so it's so far away and the concentration is so low that what you inject into yourself doesn't talk to the alpha cell to turn it down, turn down the noise. So it's still producing glucagon. That's why a type 1 is a little harder to control, is because those two talking cells don't have any more communication. And that gets to be a problem. So are they making glucagon inhibitors? Yep, they sure are. But no, I don't know anything about transplanting new islet cells or new beta cells. I mean, I think they've tried. Why would they want to try? I mean, you would take away all the diabetics in the world, wouldn't you? But then they wouldn't change their diet because you would just get overactive and start doing the food things, and you would just pump out more processed food to make them eat more and get more obese and do the whole thing over. And then they ruin the ones that they transplanted. I mean, I guess it would work for everybody. It's a win-win for everybody that wants to make money. What do I think about lifeline screening blood tests? Are those acceptable to you for an appointment conversation with you as well? Absolutely. You don't have to get any new labs. If you got some old ones, I can discuss those. If you have a lifeline screening, that would be awesome. We could talk about that. All of these things are that if you haven't had a chance to go over them with your own doctor, or they poo-pooed you, I would be happy to go over them with you. You don't have to, but if you want new labs, get new labs. If you don't know what to order, I'll send you a list. If your doctor won't order off that list, then the only other option is you have to look elsewhere to try to get them. I can help order them if you're in, certain states. I can't order outside of the United States, but there's about 7 states that I can't even order in because they don't allow it. They want everything kept in state. Oh, geez, Metabolism IQ says they're actually putting the islet cells in the liver. So they're putting the beta cells in the liver, but yet the person has to be on immune therapy for the rest of their lives. Sounds like a great deal. Because it's foreign material. You're taking islet cells out of me and putting it into you. And so I have foreign islet cells. So you're going to develop an immune reaction to my beta cells, okay, if I try to give you some. And now you're going to have to be on immune modulating therapy for the rest of your life because you have a foreign, just like if you get a liver transplant or a kidney transplant or any transplants, you could be on medications for the rest of your life to block your own immune system from finding a foreign body in you, which, by the way, every time you eat something, you're producing a reaction that's foreign. Every time. Okay. Murray says, would you be willing to give a quick summary of your daily or weekly diet? I'm curious what you eat on a daily basis. So on a daily basis, it is the same every day. Not every day, but I eat 1 or 2 meals a day. It just depends on the day. I don't know if I'll get 2 meals in today because I haven't eaten yet. And usually when I eat till I'm comfortably full, and then I eat again when I'm hungry. But I could be getting hungry in the middle of the night and I'm sleeping, so I don't know it. So my meals consist of about a pound of meat in a day and 6 to 7 to 8 eggs in a day, a stick of butter in a day. And that's through my cooking, or I drizzle it on my foods. I will eat sardines 2 to 3 days a week. I will eat some form of liver, either chicken liver or liver sausage. I know that that is not complete liver. It's actually only a third liver, but it's a good source if you like liverwurst. I happen to have grown up with liver sausage, so I eat that every day. Chicken livers I'll eat every other day. I don't eat as much beef liver. I just not fond of the taste. I will eat it if you made it for me. I will definitely eat it if you made it for me. I just don't want to make it. Just like I don't want to make fish. I will eat sardines, I'll eat tuna, but sardines are a very good source of omega-3s, and 3 days a week I will definitely get those. Okay? Yes, Sass, I can order labs in Texas. But as far as my diet is concerned, that's about really all I eat. I rarely eat chicken. I might eat chicken a couple times a month. I will take a few bites of pork here and there because I make things for my dogs as well. They eat all different types of meat. They'll eat pork and chicken and turkey, and they'll eat lamb. I eat lamb, but they'll eat beef. They eat all kinds of meat, whereas I will not eat everything. They'll even eat sardines. Now, I got to be careful giving them sardines because they're really fatty. And like tallow, my tallow guy, my beef tallow, he will have diarrhea. Oh, my goodness. Not really diarrhea. It'll just be like pudding for a day. And we don't mess with pudding. So we don't give sardines too often. I'm talking a half a sardine they might eat, and that'll be about it. I do not do anything in olive oil. It's always in water. In oil, you're getting, those are seed oils. I do not do seed oils. I know it says it's olive oil, but I would never trust it. It's cut, and it might be 10% olive oil and 90% seed oils, which is sunflower, safflower, soy, cottonseed, canola, corn. I'm not putting that in my body. Those are processed industrialized oils, and I don't trust them. If I want to add a monounsaturated fat to, like olive oil is a monounsaturated fat, I'll add an avocado. I would not with my sardines. I will never drink any oils, okay? I stay away from oils unless I melted my butter in the pan and I drank it. That would be considered an oil. Penny says, if you order different things that the insurance will not pay for, can you order that separately? Yes. Well, I don't know what your question is. If I order your labs, you guys, insurance will not pay for them, but you can turn it into your insurance and maybe your HSA can cover it. Like a lot of my clients will use their HSA health savings account, their credit card to pay for their labs and then turn in the receipt. And it came from a health company, and a lot of times you can get it approved. So that would be the only thing. You could, that would be about the only thing, you guys, that I could say. But when your doctor won't order them, even if your doctor ordered them, even if your doctor ordered the tests and they didn't put a code that matches why that test is needed. Let me give you an example. You want an insulin level and they don't put a diagnosis that goes with that insulin level, it will not get paid. A diagnosis could be high glycemia, high blood sugar, high sugar, emia in the blood. Well, but I don't want that diagnosis. Well, then I guess you'll pay for your insulin level. It could be $15. But whenever you get a thyroid, for instance, you want a TSH, a free T3, a free T4, a reverse T3, a TG, and a TPO. If the doctor doesn't put a diagnosis like subclinical hypothyroidism or fatigue, just fatigue, even you just put that fatigue. A fatigue will pay for a thyroid. A fatigue will pay for your hemoglobin, your CBC. A fatigue will probably pay for a CMP. But the doctor has to attach a code in order to get it paid for. If they're being lazy, guess what? Then the lab will bill the patient. You, to get the lab, to pay for the lab. Your doctor has to do some work for you, but you pay them to do that. You know, I have had, I'm very conscientious with people's money. I really am. I do not want them to use their own money. They're paying $5, $6, $7, $8, $1,000 a month for insurance, yet their insurance is denying them getting labs. And I think that's a crock, okay? That they shouldn't tell you what you can and cannot have done, but yet you're paying for it, okay? So I make sure that I have a diagnosis for everything I order. And if I don't, I will tell the patient that this could be $50 on your side. And they say, you know what? Do you think it's worth it? And I say, no, you have to feel if it's worth it. And then I tell them what it'll tell them. And they say, yeah, just do it. Just do it. I'll go pick up cans on the side of the street for $50. It's just up, it's up to the person. But see, I like to be transparent with my patients and clients. You really have to work on your doctor if you want that to be, So hopefully, Penny, that answered your question in regards to the insurance. Yeah, Penny says she doesn't have any problems paying for the things the insurance company won't pay for, the labs. So, and everybody who comes to me, they don't have any problem paying for the labs. They know that their doctor's not going to order them and they're going to have to pay for them anyway. And honestly, if I were to order Penny's labs and I get a CMP and a CBC and a CMP, and I get a C-reactive protein and I get a uric acid and I get an A1C and I get 20 different labs, okay? And I don't have a diagnosis for them. She just wants everything, vitamin D, everything, okay? The lab from the like if I draw her lab in my office and then I send it to the clinical lab, they're going to charge Penny full price for the things that didn't get paid for by her insurance, full price. Whereas if I were to order the labs that Penny didn't get, they might be 50% cheaper. So instead of a $200 bill for the ones that they didn't order or pay for, I can get them for $100. So you have to weigh all of the costs. And I'm pretty good at costs just because I've been doing it for 27 years. But again, I could miss something and yeah, you'll get a bill for $300 and then I feel bad. Okay. Sass says, what are the different kidney tests? To start out, you should get a CMP. You want to know your BUN, creatinine, and an estimated GFR. So little e, big G, big F, big R. Now, the BUN and creatinine, so you guys call it the bun and the creatinine may not be very accurate, okay? So I like to get something called a cystatin C, cystatin, cystatin C-C. That is a really accurate GFR. Now, you could also get a urine microalbumin. So you'll pee into a cup and they'll check if you have protein in your urine. All right, not a dipstick, they send it out. That is another good test. You could get a 24-hour urine test, but that might not be necessary. You can get an ultrasound for your kidneys, but that might not be necessary. You have to kind of have a diagnosis to get those other tests paid for. So if your GFR was low, say it's 35 and it should be 90, you might want to get an ultrasound of your kidneys and check the anatomy. Okay, you might have stones in your kidneys, in the ducts, in the piping, and you want to know that because that can decrease your amount of filtration rate in the kidneys. There's a lot of things to look at, but getting a CMP, complete metabolic profile, and looking at your BUN, the creatinine, the CR, and the little e, big G, big F, big R, estimated GFR. But a more accurate is the cystatin C. It'll give you all of that, and you can almost put your chips on that one. That's going to be accurate, okay? Dana says, or Danae says, I think the whole insurance system is a crock, nothing but a money racket. All right. All right. I think that's Penny answered her question, you guys. All right. So we'll call it quits for today. I will be back tomorrow, Lord willing. I'll be back Sunday at 10 a.m. Central. So every Saturday at 9 a.m. Central, every Sunday at 10 a.m. Central. I want to thank everybody for the super chats and the super stickers. It helps this channel. And you guys have a blessed Saturday, and go Michigan. They play in about 45 minutes. So you guys have a good day. All right, see ya.